Hey, welcome to Chat with the Mama's Physio, where we dive into the world of the pelvic floor, tackle all things pre- and postnatal, and chit-chat about women's health and wellness. Remember, what you're about to hear is intended as general information. It is not meant to replace your healthcare provider, communicate a diagnosis, or act as treatment. Now that we've gotten all that out of the way, we invite you to pull up a chair, join in on our conversation, and enjoy the show. Hello, Cara. How are you doing today?
I'm doing really well, Ivy. How are you?
I'm doing well, and it's great to see you, and I thank you again for being my guest today on this very important topic that a lot of people don't really know about, and that is pessaries.
Yes.
So people are learning more about prolapses, but I'm still surprised at the number of people who come into my office, and when I bring up the topic of pessaries, they're like, what is that? So you are a pessary expert, and we're going to learn so much from you today. But before we do that, I just want you to share with our viewers a little bit about your story. How did you get into this world of pelvic health and specifically into pessaries?
Okay, thanks. First, I just want to say thanks so much for having me, Ivy. I'm super excited to be here. Okay, so it all began when I was studying physiotherapy. I was introduced to the world of pelvic health, and I knew at that moment that I wanted to work with this area of the body, and particularly with women. How I got into pessaries is, as I was practicing pelvic health, I was referring my clients back to their GPs, who would then be referred on to their gynecologists. And often my clients were waiting a number of months, 9 to 12 months, to see the correct professional to have an assessment and fitting. So when I was presented with the opportunity to take a course about pessary fitting, I jumped on it, and that has since been my area of focus, to try and offer accessible, knowledgeable care in a really timely fashion.
That's awesome. I think I love it. I love the fact that pelvic floor physios are perfectly positioned, I believe, to fill that gap that exists for many people waiting to be fit with a pessary.
Yes, 100%.
And I like, it's a bit, there's a bit of a setup that's required, of course, so not every pelvic floor physiotherapist can do it. But I just think that it's something that's going to continue to grow over the next few years for sure. And it's hopefully going to just become accepted, like, hey, you need a pessary, go see your pelvic floor physio. Yeah.
Yes, absolutely. Yes, I'm really hoping that it will pick up like that as well. There's no need for women to be waiting for a long, long time. So
yeah, especially since it so impacts their daily life. If someone is actually at the point where they need a pessary, like, you needed it yesterday, not in 9 months.
Yes.
When things have gotten worse for you and now you can't walk to work or whatever it is, you know.
Exactly. Yeah, huge quality of life ramifications.
Exactly. Yeah. So what you're doing is so important. So please briefly describe, for people who are listening who maybe don't exactly know what a prolapse is. What is a prolapse? I know we could spend an hour talking about that, but just in summary, perhaps how would you explain it to one of your clients about what a prolapse is?
Right. Okay. Yes. So a prolapse is descent of any of the pelvic organs. So that could be our urethra and bladder, the vagina, cervix, and uterus, or the small, the bowels. Occasionally we can have a prolapse or descent of the small intestine as well, but I'm primarily going to be talking about the 3 pelvic organs: bladder, vagina, rectum. And so when I say descent, I mean that those organs can eventually hang a little bit lower, sit a little bit lower in the pelvis. Now, as the prolapse becomes or increases in severity, sometimes these organs can start to fall through the vaginal opening. So that can be the bladder starting to peek through, or the top of the vagina and the cervix peeking through, or the rectum. Now sometimes I get the question, is my organ going to fall out of my body? Is my bladder going to end up on the floor? No, the organ will never fall out of the body, as it is still attached with different tissue and ligaments and fascia. But this can become really uncomfortable. Typical symptoms of a prolapse, any of those prolapses are heaviness in the pelvic or vaginal region, as well as rectal region, bulging, pressure, things like that, right at the base of the pelvis.
Yeah, that's a great explanation. And I appreciate your being careful with the language you use too, because I'm so sure that everyone who's been diagnosed with a prolapse immediately jumps on Google and starts looking at those horrifying images and reading all kinds of information that might not be helpful and that can actually sensitize them even more, and thereby causing a worsening of their symptoms, right? Because now they're perhaps carrying a bit more tension and some more fear surrounding their condition, and that all can actually cause their symptoms to worsen. So
yes,
I
absolutely.
think it's important for us to be careful how we explain things to people, and that people get their information from credible, helpful sources.
Yes, couldn't agree more. Yes, I often don't advise or advise my clients not to go Google prolapse and images. Yeah, exactly. Not helpful.
Yeah. All right, so that's great information to have. Let's talk about treatment options. There are different ways to treat a prolapse, for sure, that include physiotherapy and not physiotherapy. Can you perhaps share specifically today about the pessary option?
Yes.
In what situations would a pessary be appropriate or perhaps inappropriate for someone who's seeking treatment for a prolapse?
Yeah, great question. Okay, so those instances when a pessary might be appropriate, many different instances. I will just start off by saying pessaries in the past have been viewed as an appropriate form of treatment for a very select group of women. And that group of women typically is postmenopausal. So this is what we'll see a lot of. And we're seeing very, very, very slow trends, realizing that many more women and a much wider spectrum of women with who vary in age, stage of life, severity of prolapse can greatly benefit from pessaries. So I'm just going to put that out there that slowly our practices are changing for the better, but takes a while. Anyway, so people who could benefit. People who have just had a baby and they're feeling some heaviness, some pressure in the vaginal area. Perhaps this person has been diagnosed with a prolapse, perhaps they haven't. It can be really beautiful when paired with pelvic floor rehabilitation. So sometimes to have just a little extra support in the pelvic area while you're rehabilitating your muscles in the near postpartum period can be very helpful, both mentally and physically. We often hear moms wanting to be and needing to be able to be a little bit more active than perhaps they've been advised to be. And this can just add a little bit of support, extra support. So that's one group in the early postpartum. Let's say a woman has been diagnosed with a prolapse and she is considering surgery in the future, but she's not done having babies yet. A pessary can be a fabulous interim treatment. So oftentimes a woman is not a surgical candidate if she is not done reproducing and having kids. So this can be a fabulous go-to for the couple of years in between. So that's another population. Another population is anyone who has been to pelvic floor physiotherapy and they're making great progress until they sort of hit a plateau. And sometimes this happens. Sometimes we can't reach 100% of our goals. So let's say there's a little bit of residual heaviness, pressure. Maybe it only happens when a woman goes for a run or a long walk or whatever it might be. A pessary can be a fabulous sort of like a sports bra for the pelvic floor during those activities. Other women that it's appropriate for are those women who are awaiting surgery. We know that unfortunately we have long wait times sometimes. So awaiting surgery, or those women who have chosen not to have surgery for whatever reason, or women who would like to have surgery but unfortunately are not surgical candidates, perhaps for a different medical reason. So there are lots of women that a pessary can be appropriate for, ranging from young women all the way up to, I have no age limit actually, and all sorts of activity and lifestyles can warrant pessary use. So my message here today is that if you do some reading or you hear that, oh, pessaries are only for X category of women, just to maybe challenge that, because I have seen it clinically and in the research be very helpful for a wide spectrum of women. Awesome.
That's great. I have one question for you. Pregnant women who have pre-existing prolapses that their symptoms are kicking up during pregnancy for whatever reason, is that something that's contraindicated or not?
Yeah, great. Thank you for that question. No, so pessary use is not contraindicated during pregnancy. The caveat is that a physiotherapist cannot fit and assess a pregnant woman for a pessary. This must be done by the OB. So thank you very much for that clarifying question. It can be a lifesaver during pregnancy for some women. So if you are pregnant and you're feeling these symptoms, or you had a prolapse previously prior to becoming pregnant, this is certainly a great conversation to have with your OB to see what can be done.
Awesome. That's really good to know. Who might a pessary be inappropriate for?
Yeah, good question. Okay, so there are a couple of different medical conditions where a pessary is not indicated or not warranted. These are things like if there's active cancer in the vulva or the vagina or in the pelvic region. In the case of endometriosis, pessaries are often contraindicated. The reason being potential increased discomfort with pessary use. Other contraindications are medical situations such as, let's say, dementia, or where there isn't a caregiver that could oversee the use of the pessary. We'll get into this later, I'm sure, but risks of pessary are greatest in the situations where there is chance for neglect so those are some of the major populations where a pessary is contraindicated. So very few overall.
Yeah, that's really awesome to know. We have so many more options available to us than we realize, and I'm waiting for people like you and people like me to really be raising the level of awareness. So sometimes I find that, my clients are initially a bit resistant, which we'll talk about a bit later, to the idea of a pessary, but then when they try it, they're like, oh my gosh, I really wish I had tried this sooner.
Yes, absolutely. Absolutely. Yeah. I just saw one woman this morning who had a history of not wearing tampons because it was uncomfortable for her. So she was a little bit weary, like you were just saying, a little bit resistant to the idea. We put it in, couldn't feel a thing, was so relieved and so happy. So yeah, it's a great option to try or to ask someone about. Yes.
Yeah, that's awesome. All right, next question. Different types of pessaries. There are many. I do not fit for pessaries, but I know enough to know that there's many different out there. I think I've seen at least 20 different styles of pessaries out there. What styles are there available? What are the materials made out of? What are the purposes for the most common styles? We'd love to see what you've got.
Yeah, absolutely. Okay, wonderful. So I'll just give sort of an overview, and then I've got a few to show here as well. So yes, you're right. There are many different shapes and sizes out there. The majority that we're using in this day and age in this part of the world are made of medical grade silicone. They're resistant to bacteria growth, to odor, things like that, and they take a long time to break down, so they last for a long time. Also, very few allergies. Of course, if there's a known silicone allergy, but the majority of pessaries are made out of silicone and not latex to avoid that potential. Okay, so many different shapes and sizes. Now, there are some pessaries that lend themselves a little bit better to different kinds of prolapses. That said, pessary fitting is really trial and error. It is dependent on so many different things. Each woman's anatomy, her specific prolapses, what she's going to use the pessary for, how often. Even things to consider are other comorbidities, such as, let's say, arthritis in one's hand, because some pessaries are easier to manipulate and to insert and remove. So there's a whole host of factors that we take into consideration when we're choosing the correct shape or type of pessary. So I've got a couple of the most common ones here with me today. We're going to start with, I'll show you a ring pessary. So this is just an example pessary. So it's neon yellow, but this ring is, the research says, fits about 80% of women who try it. So a large percentage will start with this. This is the easiest to insert and remove. I always offer my women the opportunity to learn how to insert and remove the pessary herself. I think it gives a feeling of independence and freedom, also security if she gets into a position where she wants to remove the pessary. If she is able and knows how, has the understanding and the knowledge to remove it herself, that can be really empowering. So this is one that we often start with because of its ease of insertion and removal. The way, the number one comment I always get is, oh my goodness, the pessaries look big, but we are able to manipulate them. They are malleable. So this one is inserted, shaped kind of like a taco, so that we really decrease that diameter. I don't want to scare anybody on here. So, so that's one of the most common ones. Another one that I have that I really find quite useful in many different situations is the cube. Okay, so 6-sided dice with concavities on each side. Now this one works quite differently than the ring. This one is called space occupying, so it takes up a lot more space in the vaginal canal. It also works by suctioning against the vaginal walls. So this one is great, I find, for my active women, let's say an avid runner, where we need lots of support of the pelvic floor, but we also don't want to be concerned about the pessary coming out or falling out. So this cube with a little more suction is a great option often. Now some of the differences between each of the pessaries is this cube must be taken out every day, just due to its shape and the suction that it uses to stay in place. So that's one of the factors that we think about. Is this going to be realistic for a client to take in and out every day? Whereas the ring can be left in for a couple of days. So, and then I want to show you one other one. It's called the Gell horn. So here we are. So it sits in the body in this position. So cervix and uterus sit up here, and this knob sits near, just above the vaginal opening. Now this one uses a little bit of suction on the top as well. And then this stem just adds extra support so that it sort of lodges itself in the vaginal canal and stays put. This one is quite good for more advanced prolapses, grade 3s or grade 4s, but that rule is, it has to be taken with a grain of salt. I have definitely used ring pessaries with more advanced prolapses, and they work just fine. So again, it depends on so many factors. But just recapping, the ring, the cube, and the Gell horn are 3 of the most commonly used pessaries, all for sort of different anatomy, different goals, and different prolapses.
Yeah, that's great. Thank you so much for showing those. It's so good to have a visual, actually. And I do have a question about the cube. So I know you said it needs to be removed every day.
Yeah.
For someone who is fit with a cube during their period, where they might have 4 or 5 days of bleeding,
Right.
what are their options around that time of their cycle?
Right, thank you. So all of the pessaries that we fit have holes in them, and those are for drainage, whether it's vaginal discharge or menstrual blood. So actually we can use pessaries during one's period, so that's wonderful. Now the caveat here is that we cannot use a tampon and a pessary at the same time.
Right.
So pad and pessary, totally fine. Or if a woman wants to switch during that time of her month to just tampon use, then that's an option as well. Yeah.
Okay.
Thank you for that.
That's great. I'm also curious as well for incontinence pessaries. Is that something you fit for often?
Yeah. So not as often as prolapse, but definitely is an option. Now I've got an incontinence pessary with me here today. So the way incontinence pessaries work are they put a little bit of extra pressure at the urethra, the tube that drains the bladder to the outside of the body, and puts a little bit of pressure there, just helping to keep the urethra closed. Not so much that a person can't empty their bladder when they mean to, but just to help with the leaking during coughing, laughing, sneezing, running, jumping, things like that.
Yeah.
So I'll show you one of those guys. I've got a dish here. And so the knob here is what's particular to the stress urinary incontinence. So this would sit inside the body as if this is the front, this is the back of the body. So the bladder would be sort of right here and the urethra right here. And the knob pushes a little bit on the urethra to give just a little extra closure. Okay, so, and this pessary also is for somebody who has stress urinary incontinence and prolapse. So the prolapse can sort of sit in on this trampoline part. Right. So, yeah, and then there are some pessaries that are just for stress urinary incontinence as well with no prolapse. So that is definitely an option if a woman comes to me just with stress urinary incontinence.
Yeah, it's so great that there's many different options and shapes and sizes out there for. It sounds like you can customize someone's experience, give them the exact pessary that they will need for their unique presentation and their body, as opposed to just some standard ring pessary.
Right. Yes. And I think you hit on a really important point, Ibby. Sometimes I will discuss with the client, they'll give me a call or they'll come in and say, oh, I tried a pessary years ago, didn't work for me. Yeah. And always they will have tried one pessary, maybe one size. So you're totally right. If you are listening and you have tried a pessary in the past and it wasn't quite right for you, don't stop there. I really urge you to speak to somebody, to find somebody who has and is willing to fit you for, try as many pessaries out there to see if there is one that will fit you quite well. Yeah, because there are lots of varieties out there. So
that's awesome. So let's talk about the next steps. Let's say I'm someone who has decided I need a pessary and I'm going to Cara. What is the process for being fit with a pessary? And I'll just add, I know that OBGYNs can obviously and do fit for pessaries. I'm not sure if family doctors do, but I know specialists do. How would their evaluation process be similar or different from a pelvic floor physiotherapist's process for fitting?
Oh yes, so many good things in there. Okay, great. Okay, so let's start with the logistics of if you, Ibby, wanted to come get fitted for a pessary. So that all starts with a phone call to somebody who fits it. So let's say you're coming, yes, you said you're coming to see me, so you give me a call. I don't need anything for you to come in and have an assessment with me and get fitted for a pessary. Okay, so we don't need any doctor's note, we don't need a referral, we don't need anything like that. Now, what I do need is comes into play at the point of sale for the pessary. Okay, so we can do everything we need to do. We can figure out what's going to work the best. But when you go to purchase that pessary, I do have to have a form from a doctor or a nurse practitioner. So any medical doctor and nurse practitioner, stating that you are free of those few things that we talked about before, endometriosis, or you're not pregnant at this time, or you don't have active cancer, etc. Just to make sure that the women that we are fitting are safe to use a pessary. So Now, what I do often is I would just take down your doctor's name with your consent, Ivy, and I would fax off the form that I need filled out. And I would request a written prescription for a pessary, and that's it, that's all. So I usually take care of the paperwork behind the scenes with your consent and your doctor's information. And then that's all we need to complete the assessment and the fitting and everything. So really straightforward. Now, do you have any questions about that before I go on to
No,
how it
continue.
differs? Okay. All right. So you mentioned in the beginning, beautifully put, that you believe, as do I, that physiotherapists are uniquely and perfectly situated for pessary use for pelvic organ prolapse and stress urinary incontinence. And the reason I say that is for a couple of different reasons. Our healthcare system is wonderful, and yet we often have long wait times and many clients for our gynecologists to see. So one of the things that we have the privilege and honor of is often being able to spend quite a bit more time with our clients than some of these specialists can. I see my women for typically an hour for the assessment and fitting, and that allows us time to try different sizes, try different shapes. It gives the woman a chance to walk around the room. If there's an activity that she's coming, she says, oh, I only feel the heaviness in my aerobics class when I'm doing jumping jacks or burpees or whatever it is. We take the time in our appointment to do those jumping jacks and those burpees to make sure that the pessary that we've chosen is going to add the necessary support. So we have the freedom and the ability and the time and the space to really try it out. It's like buying a pair of shoes. We really need to know that when we walk out of the store, they're not going to be hurting our feet, right? So it's the exact same thing. So we do lots of functional movement. I always make sure a woman can void her bladder, so I have her go to the bathroom. So the time is one of the biggest pros that I think we can really spend some extra time with our women. Another thing is that, again, it's tied into the time. Sometimes I have women who have been fitted appropriately for a pessary, but because of shortage of time and client demand in our specialist streams, perhaps they weren't taught about removing or inserting the pessary themselves, or how to wash and clean it and care for it. So those are all things that we go through. We have the time to really go through a lot of education, which is totally empowering. Yeah, so that would be the biggest things that I think the pelvic health physiotherapy sector can really add to this service.
That's awesome. So that's great. Let's go on to the next question. How will somebody know if the pessary is a good fit for them or not? Let's say it feels great in your office, but then, so what are some signs that I should be calling you or coming for a follow-up visit?
Yeah, absolutely. Okay, thank you. So some of the obvious signs would be, and this happens, so we have to talk about it, but if the pessary falls out. So let's go, but let's break that down a little bit, because our bodies were made to deliver and expel human beings. So any of us could push out any pessary. Right. So I have to explain a little bit around if it falls out. So I'm talking about if you're walking down the street and the pessary, you can feel the pessary starting to fall out, sort of like a tampon that's not in right and it's starting to fall out. That's not okay. So that's a call back to me. Maybe we need a different size, a bigger size, or maybe we need a different shape, maybe one that's like the cube, a little bit more suction, a little bit more support. So if it falls out. Now, if you, let's say, struggle with constipation and you're straining on the toilet to have a bowel movement and you have a ring pessary in, that ring pessary can fall out. And in that situation, it's not necessarily that the pessary is the wrong shape or size. It is that we can produce a lot of pressure, downward pressure, and can expel that pessary. But if you are experiencing descent or it's falling out outside of situations where you're really putting a lot of pressure, downward pressure on your body, then that's a call to me. Okay, so number one, falling out. Number 2, pain. If a woman says that a pessary is painful in my office, she's not allowed to walk out that door, right? So we are using the pessary to better symptom management. So if it is uncomfortable or painful, that is definitely a call back to me. Now, there are a minority of women who will feel the pessary in my clinic or in my office, and 85% of those women eventually, after a short time, just the body forgets that there's something inserted and it just becomes normal. So the majority of women, that feeling of just unawareness of something being there is going to go away. But if a woman does feel that for the first little while, it doesn't mean that a pessary cannot be used. So that's important. Sometimes it takes a little bit of adjustment of the body, and that can vary from woman to woman, how long that takes. If you're having trouble voiding the bladder or the bowels,
Sure.
that is definitely, we want to get that pessary out so that those organs can evacuate what they need to as soon as possible. But that is the reason why I do have every woman go to the bathroom and make sure she can void her bladder at least before she even leaves the clinic. Now, if a woman was to remove the pessary and notice some blood on the pessary, this is another call to me and her doctor. Now, this can happen and it needs to be addressed, but it does not necessarily mean that a woman can't go back to wearing her pessary. This appropriate steps in this situation would be a call to the doctor, and where they will do an internal exam just to see the source, what is causing the bleeding, and then more often than not, we just keep the pessary out for a couple of days, allow the tissues to rest and heal. We might give, the doctor might give a cream, a topical estrogen or something like that, just to help the tissues heal a little bit quicker. And then we're back to wearing the pessary as per usual. So if a woman sees bleeding, not to be ignored, but there are steps that can be taken. So those are oh, and I'll add one more. If a woman starts to notice an increase or the sudden onset of an infection, it may or may not be related to the pessary, but something like a yeast infection where there's itching, or even a UTI where there's burning with urination and frequency and urgency of urination. I rarely, actually, I've never had a client experience this, but that is just something to be on a woman's radar. How we can try to combat that is just great hygiene. Cleaning the pessary is super easy. So just making sure that we're doing that and rinsing it super well to make sure there's no irritation of the urethra or anything like that. So those would be reasons to give myself or a doctor a call.
Awesome. I'm going to just hit pause for 1 second, Cara, with the recording, because my kids are really loud. I don't know if you can hear them.
No, I can't.
Okay. I'm going to go tell them just to be quiet, and I'll be right back, okay?
Sure, of course.
I'll get some water too. 1 moment. Okay, so the next question is progression. Sometimes, correct me if I'm wrong here, but sometimes I will tell my clients that there is a chance that they may no longer need to wear a pessary, or that they might not need quite as large of a pessary over time as they are doing rehab and as they are getting stronger and developing, better supports, things like that for their pelvic floor. Should I be saying that? Is that right? Is that wrong? Do you ever see, get women to the point where with rehabilitation, they actually no longer need to wear a pessary?
Yes. So wonderful news. Your message is totally correct. Yes. So particularly if women are doing physiotherapy as in conjunction with wearing their pessary, we often see sort of downsizing in size, like you mentioned, but we also see many women who just use a pessary for a very specific amount of time. Let's say postpartum, she might wear it for 6 to 12 months, and after that time has built up enough musculature on her own to not need the extra support of the pessary. So yes, that is very much a possibility. particularly, I would say for my premenopausal women, not that it can't happen postmenopausal, but that is something that is a realistic possibility. And then on the other hand, I do have other women who pessary is a long-term, lifelong solution.
Yeah. Yeah. And when you share that with
Mhm.
your clients, how's that received?
Yeah.
I've had a lot of tears and, people
Yeah.
being basically devastated by this idea that they have to wear a pessary for the rest of their life, potentially.
Right. Yes.
How do you share that news with people in a way
Yeah.
that's hopeful, but also realistic?
Right.
Um, and how can you kind of warm them up perhaps to the idea that it's maybe not as bad as they think, or
Right.
not to minimize their, what they're feeling, but just that it is an option for them that can be very helpful.
Right. Right. Yeah. Yeah. Great point. Yes, the diagnosis of a prolapse can be devastating. Absolutely. So, yes, I often see tears in my office room as well. But there is good news. And you asked what I sometimes message to sort of give that hope. And I can say 95% of the time, if not more, by the time the woman leaves, even that initial appointment with the pessary, they are already feeling much better about potentially having to use it on a long-term basis. And the reasons are the pessaries might look a little bit scary and sound a little bit scary, but really, particularly, I have lots of women who have used a diaphragm, let's say, as birth control, or have used tampons during their period. And the pessary really just becomes one of, just like one of those other items. It becomes really easy to insert and to remove, so it doesn't take up much time throughout the day. They slip it in the morning, forget about it during the day. They might take it out at night, for example, just one scenario. It really doesn't take away from the time that they have or the quality of life, and the benefits of returning to being more active with their kids or their grandkids, or no longer experiencing the bothersomeness or the achiness that far outweighs the minimal hassle of having to use the pessary. And with a little bit more knowledge about one's body, and that this is kind of like we talked about before, putting on a bra. Most of us do it most days. And it's really sort of akin to the same thing. That gives us a little bit of support for our ligaments, our soft tissue. Same with the pessary. And it just becomes something that the benefits outweigh the negatives of it.
Yeah.
Yeah.
That's good. A good way of putting it. And I think the power of the experience as well. Once they feel that difference in their body, they're like, okay, this is doable. I think I can do this.
Yes, yeah. Exactly.
I have heard on just through the grapevine of people who do not get fit for a pessary, but they're using different objects in place of a pessary, like a tampon, or even there's external supports and different products out there that people. I mean, how effective are those? How safe are those? Is there ever a time or place where you would actually suggest it's okay for people to use, the non-medical grade silicone pessaries and just try something on their own to sort of test it out before maybe committing to a pessary?
Right. Yeah, great question. Okay, so yes, I have heard many people as well just try it on their own or be advised to use a tampon or multiple. And I do not advise this. And the reason being is that tampons, of course, were made to be absorptive, to absorb, blood during our period. Now, this is not something that we want to be doing all the time, right? Our vaginas are lubricated for specific reasons. It helps keep us clean and free of infection. So we do not want to, when we don't have our period, be using a tampon because it will absorb the natural good moisture in the vagina. Now, maybe in some situation, let's say if a woman had to drive many hours to see a pessary fitting professional and just wanted to know if maybe something in the vagina could help give a little bit of support, maybe in that instance, I would say, okay, when you have your period and you put a tampon in, do your symptoms get better? So maybe in sort of an off situation like that, I would ask that question. But for the absorptive purposes, I do not recommend that. So yeah, great question. There are, of course, Poise makes something called Impreza that used to be on our drugstore shelves. It is being pulled off. Now, if a woman, and that's for stress urinary incontinence, not for prolapse. So that is made of the correct materials. It's medical grade mesh around, medical grade silicone inside. So if a woman wants to try something like that off the shelf, totally fine. I have a lot of women who don't particularly love the Impreza, find it's a little bit uncomfortable, a little bit pokey, or is the word that I often hear. But that is safe and fine to trial. Yeah, and then as for external supports, yes, so there are a number of different, well, a couple of different supports out there. One of them that we'll often use is the V2 supporter, can be used in many different pelvic health conditions. Now, this might be warranted if a woman tries a pessary and just for whatever reason, her body just does not accept it or does not tolerate a pessary, but she would still like some relief and is not a surgical candidate, then a V2 supporter or an external, something that adds a little bit of pressure to the vulva, so the vaginal area at the bottom of the pelvis, that can be helpful for symptom management. It's worn under one's clothes. Some are really great at sort of being concealed so that you don't see any lines or anything like that. So that is an option. And I have had a handful of clients in the past where combine those two. So an external support with the pessary, and they felt this. One woman I'm thinking of was an artist and did during her exhibits. She was on her feet for a really long time, so she used both the pessary and the external support. So can be warranted in certain situations. Yeah.
Thanks for clarifying. I think it's important to hear from a professional that double tampons up your vagina does not replace pessaries. So please,
yes,
stop it.
Thank you. Yes.
I'm being very kind when I'm trying to be very kind as I say that, just being real.
Yes, thank you.
Okay, so let's talk about physiotherapy and pessary use. Mm-hmm. Does using a pessary mean that people no longer need to come for pelvic floor physio? What are your thoughts?
Right. Yeah, great question. So although my focus is on pessaries, I very much promote and encourage my clients to continue with rehab or start rehab. Really, always the best scenario is when our bodies can support themselves. Okay, so there are very minimal risks of a pessary, but we can almost always make our muscles stronger or more coordinated or have better timing or efficiency or endurance or whatever it might be that we need to work on. And that is so important. So unfortunately, a pessary is not going to work best if we just put it in and forget everything that our pelvic floor physiotherapist has talked about using our breath and not bearing down when we're on the toilet, eliminating our bladder or our bowels. Or going to the gym and forgetting about all the correct technique. So yes, that's a very important point that we have to still be mindful about how our body's moving and functioning and how we're using our body. And I will say that when we are concurrently going for rehab, building up the muscle tone of the pelvic floor, not only does that help to support our pelvic organs, but it also helps to support the pessary as well. Mm-hmm. So there are so many great things that come from continuing to do rehab. Another thing that I will just mention is sometimes people ask who are doing pelvic floor physiotherapy at the same time. Maybe a colleague has referred them to me because they don't fit pessaries, but they're going back to my colleague for continued rehab. They ask, should I wear my pessary when I'm doing my exercises? And my answer is yes, absolutely. And the metaphor that I give is when we have organ hanging down into the vaginal canal, and we're trying to, or past the vaginal opening, sorry, and we're trying to close our muscles around it, the muscles can't necessarily close all the way. So I like to think about elevator doors with a box in between the elevator doors, and the elevator is routinely trying to shut, but that box is in the way, so the doors can't move through their full range of motion. But if we get a pessary in there, brings the organs up, now our muscles below are able to go through their whole range of motion, so you can potentially get even more benefit out of the exercises that your pelvic floor physiotherapist has prescribed for you. So
awesome. That's really helpful for me to know as well, actually. So thank you.
Yeah.
You know, I just had a random thought. So sex. Okay.
Yeah.
When people use pessaries, like, is the pessary supposed to come out during intercourse,
Right.
or does it stay in, or does it depend on the type of pessary?
You're exactly right. Yes, depends on the type of pessary. So the ring, the most common one, can actually be left in for intercourse. So it sits inside the pelvis, and the penis actually just will go right underneath it.
Sure.
No problem. No. Yeah. So for those spontaneous times, you don't have to worry about taking out the pessary. Some women don't feel comfortable with leaving it in. That's totally fine. Then take it out. But if you are fine with that, the male reports most often they can't feel anything. The female, it doesn't change anything. So yeah, that's really fine. Now the cube and the Gellhorn, definitely, because they are space occupying, need to come out for intercourse. So that's another really important thing in determining which one is best for a woman, because if a woman cannot, if I put this in and the woman can't get it out and she's sexually active, this is not appropriate. Right. So yeah, so I have to take all of those, a whole body approach, right? The whole context.
That's great. So important to ask those questions, right? Yeah. Which I feel perhaps if you were in a situation where you were being rushed through just due to realities of our healthcare system, it might be some of those questions or those concerns might not come up, and yet they can affect someone's daily life activities and their quality of life. So
exactly. Yeah, I in fact had a woman came to me about a month ago, had a Gellhorn pessary inserted and was going to see her doctor every 3 months to have it taken out, cleaned and reinserted. And her husband were sexually active and had not been told, do not have sex with this in. And she said, I'm having pain with intercourse. Oh. Yeah, I can imagine you are. Oh my goodness. Yes. So yes, you're totally right. Sometimes those things get missed. Yeah. So yeah, important. Yeah.
Another question, is it appropriate or can you use silicone lube with a silicone ring if you that's your lube of choice?
Right, great question. Unfortunately, no. Gonna have to pick out some different lube. Yes, so silicone lubricant breaks down silicone toys or silicone pessaries. Yeah, thank you for that clarification. Yeah, so a water-based lube, something that is paraben-free, glycerin-free, as natural as possible, no cherry flavors, no hot cold, nothing like that. Yeah, so yeah, very important.
Okay, great. Research is my next question. I imagine you probably do a lot more research into the world of pessaries than I do, although I have looked up prolapses and pessaries with post-childbirth in some of my research. There's not much out there, but perhaps you know something I don't. What's sort of hot in the world of pessaries right now, or is it maybe not even hot? I don't know.
Right.
What's going on in the research world when it comes to pessaries and prolapse?
Yeah, great question. And actually, there isn't anything earth-shattering happening in the world of research and pessaries at the moment. It is an area that definitely needs more research, like so many areas in pelvic health. Yeah, so pessaries have been around forever, for so long. There's actually drawings, like ancient Egyptian drawings of versions of what we now refer to as pessaries. But there isn't a lot of hot research coming off the press these days. I do know that there are more and more companies looking at developing actually literally custom pessaries, so just like orthotics. Yeah, so some really exciting things in the future. So, and those would entail each woman's own anatomy and forming something to fit each woman. So that's really exciting. But that's in very preliminary stages. So maybe in a couple of years, we'll have some research trials from that. Yeah, but that's what I can say as to the research right now.
Yeah, sounds kind of expensive, like a custom pessary. And
yeah,
then
it is.
If you would need to change it as your body changes over time, there's another $1,000 or whatever. I don't know how much
exactly. It would cost. Yes, absolutely. Great option for those women who we just can't find any pessary to work for them. Then fabulous. But yeah.
Speaking of cost, how much does it cost to get either to have a consultation with you or for the pessary itself? I'm not sure if. I don't know if it's covered through OHIP. I don't think it is. Like, I think women have to purchase it. So can you explain the costs?
Yeah, absolutely. So you're right. Pessaries are not covered by OHIP not covered by OHIP. They typically cost about $90. That will differ a little bit depending on who you were seeing or where in the province of Ontario or outside where you're going for your care. Now, whether you do see a gynecologist or a physiotherapist, you're always buying your own pessary. The pessaries can last. The manufacturer says they should be changed once a year. I do know that they can last for much longer than that. Just on that note, I'll get back to the money in just a moment, but they last for a long time. The only thing you want to do every once in a while is just check for any cracks or fissures in the pessary. Bacteria can get stuck in there and we don't want any chance of infection. But that's really the only time. They will color over time, especially like you said, if you wear it during your cycle, they will become discolored, but that doesn't affect how functional or effective they are. So about $90. Now, if you go see a gynecologist, of course, the consult is covered by OHIP. If you come see me at Toronto Pessary Clinic, our consults are $160 for the first one. It'll take about an hour, and then follow-ups are $100 and they're 30 minutes. I very typically only see my women twice. It's usually for that initial, and then the follow-up is a very important appointment. What I'm really looking for, I need to hear how you're doing with the pessary, but I'm also really I'll take a look with the speculum at the vaginal tissues to make sure there is no wear and tear, if you will, or irritation of the vaginal tissues. And then after that, sometimes women choose to follow up with me every 3 to 6 to 12 months just to check to make sure the pessary is doing what it should be doing and check to make sure that the tissues internally are healthy.
That's great. Yeah, it's I feel I know that this would be everyone has different financial reality, but I feel that that's very reasonable. Right? And hopefully that's something that if people have benefits for is covered. Right. And so that they wouldn't even have to pay for that if they have the benefits. Yeah. And if not, then it's a matter of saving up. Yep, exactly. And asking people who love you to help you out with your healthcare costs, right?
Yes, exactly.
Okay, this is great. How can people get in touch with you? I mean, we're in London, you're in Toronto, but we're also on the World Wide Web. Yeah. So, and people can travel, or perhaps you can travel in your area. How can people find you if they want to work with you?
Yeah, absolutely. So you can head over and check out our website at www.torontopessaryclinic.com. So that's a great place to get started. There's lots of information. There's also a direct contact form. So that's either for the woman herself or any healthcare practitioners, my fellow physio colleagues, or any GPs, people. I also get a lot of referrals from gynecologists who just, for whatever reason, are not fitting pessaries. So anyone can fill out that contact form and I can get in touch with them. It has my phone number, my fax number, my email, etc. on that website. I'm also on Facebook under Toronto Pessary Clinic or Instagram. or LinkedIn, your social media of choice. So whatever, or whoever, yeah. So lots of different ways to find me. Yes, and I am offering home visits in those instances where, for whatever reason, postpartum, or maybe we're elderly, whatever reason, it makes it a little bit difficult to get out of the house to my clinic. So I do come into one's home if that's the preferred method. And I'm always happy to collaborate with other healthcare professionals. So if somebody is listening out there and wants to know more, or wants to know how we can collaborate and get more pessary fitting professionals to our clients, I'd be really happy to hear from you.
That's awesome. You are an absolute wealth of knowledge, and I've learned so much from you in our time together.
Wonderful.
Thank you, Cara. Do you have any last comments or final thoughts? Any last message you want to share with people who might be listening?
Right. I just want to say that in my experience, pessaries, like pelvic health physiotherapy, can be life-changing for the better. So if you have any questions, or even just a little bit curious, or think maybe this could help me out in this particular area, give me a phone call or send me an email. I'm really happy to discuss your specific situation, and I will be upfront and honest as to whether I think that this is something that will be helpful for you, and we can take it from there.
Awesome. Thank you so much. It was lovely spending the last hour with you, and I'm going to let you go. I know you have some people to see. I really look forward to collaborating more in the future, Cara.
Wonderful. Thank you so much for having me. Take care.
Bye-bye.